Good afternoon. I am joined today by my Chief of Health and Human Services, Marty Martinez, and Executive Director of the Boston Public Health Commission, Dr. Bisola Ojikutu. And as we set our clocks back an hour this weekend and as the chill of winter arrives, we must be very mindful that we are now entering flu season. According to the CDC, flu season begins in October and peaks between December and February. I urge residents, especially our seniors, to get the flu vaccine before the winter surge. Some experts are concerned about a worse, more severe flu season this year, so getting the flu shot is that much more important. In addition to protecting ourselves against the flu, we must also be vigilant in our fight against COVID-19. Our citywide positivity rate has remained relatively stable these past few weeks. As of Tuesday, October 26, the positivity rate was 2.1%. As a city, we have all worked extremely hard to slow the spread and fight this pandemic, which is why we remain below our thresholds of concern on each of our public health COVID metrics. Our efforts consisted of equitable vaccine distribution, a vaccine mandate for city workers, an indoor mask mandate for schools, city buildings, and indoor public spaces, and new ventilation and HVAC investments for our school buildings. We made the commitment to meet our residents where they are as a strategy to tackle the racial disparities with vaccine access, which has led to some impressive results. The outcomes show full vaccination rates among Latino residents up by 36% and full vaccination rates among Black residents up by 29% since mid-April. Over 73% of residents have received at least one dose. Children between the ages of 5 and 11 are now eligible to receive the vaccine. We are working with community partners, health centers, and our schools to ensure that our students and families are safe, informed, and have access to the vaccine. In collaboration with clinical and community-based partners, we will hold vaccination clinics in Mattapan, Dorchester, Hyde Park, and Rosendale, neighborhoods where we've seen some of the lowest COVID vaccination rates. These family clinics will offer first and second dose vaccinations for everyone age 5 and up, and will offer boosters for those who are eligible. The clinics will begin next week and occur on the same day and same time and location each week through the end of the year. Families can learn more at bostonpublicsschools.org/vaccines. Information about the family clinics will be posted to boston.gov so that families seeking additional information on times or locations or anything can check there, or they can call 311 or the Mayor's Health Line to be connected with the clinic nearby. BPS will be hosting an Ask a Doctor information session on November 15th at 6:30 p.m. I encourage families to join this session to learn more about why vaccinations are important and to ask any questions they may have. In addition to the reoccurring family clinics that I mentioned earlier, many providers, including hospitals, community health centers, and pharmacies, will be offering vaccinations for residents 5 years and older. We encourage parents and guardians to check in with their health care provider with any questions about the vaccine. The vaccine is the best way to protect ourselves and our loved ones. As we continue with our vaccination efforts, we must also continue getting tested. Anyone who shows symptoms, has traveled, or who has been exposed to the virus should get tested. We are also investing an additional $500,000 to previously funded equity coalitions that are conducting vaccine outreach in communities of color. Shifting gears, I would like to address the violent assault that occurred earlier this week at the Henderson School. A student was accused of assaulting a principal and another staff member. Violence has no place in our schools. We must ensure that students and staff can be in school and be there safely. We will continue to do everything possible to make sure we are addressing trauma, which is often the root cause of violence. I encourage members of the Henderson community to take advantage of the BPS safety and crisis teams that are available. My heart goes out to the principal, the staff, and the families of those who are impacted by this violence. Every employee and student in the Boston Public Schools deserves to be safe at work and in school. We are doing all we can to support staff and students who are impacted and to address the trauma. This event underscores the importance of social workers in our schools and continued investments in social emotional learning as we recover from the pandemic. The superintendent and her team hosted a virtual meeting with the Henderson community last night to hear from students and families. And while the Henderson Upper School remains closed today, support staff are available at the school today for students and staff, and the Y is also open to support our young people. The superintendent, her team, and the Henderson staff are preparing the best ways to welcome students back to the classroom next week. BPS will soon release communication to the Henderson community to discuss additional safety protocols and next steps for returning students. BPS will continue to communicate all updates to families and to the public throughout the day and in the coming days until a solution is reached and the school community feels completely safe. As nighttime temperatures dip below freezing this week, city outreach workers have helped over 60 unsheltered individuals, referring them to inpatient treatment, city shelters, transitional housing, and assistance back to stable homes. Additional individuals have chosen to relocate to inpatient treatment, a nearby shelter, or homes of their origin. This effort has also resulted in storage or removal of over 24 tents from public streets and sidewalks. As we transition vulnerable people from encampments that have been a source of violence, fires, overdoses, sexual assaults, disease, and other dangers, we will continue to use a public health approach and treat every individual with dignity. This work is urgent, but should not be confused with sweeps conducted in years past. No person is required to remove or store their tent before appropriate shelter, housing, including low-threshold housing and beds, or treatment is available. We are continuing our work with the state and county officials across the Commonwealth to identify more low-threshold beds and to help individuals who are suffering with substance use disorder or homelessness. Thank you. I will take a couple of questions now.
The masks being lifted, the positivity rates is doing pretty well, vaccination rates getting good. Is there a magic number, or are you going to keep in place?
Yes, I will certainly be keeping masks in place. Masks are very effective in helping us slow the spread of transmission in terms of COVID. We need to continue to do what works, particularly as we work hard to get our youngest residents vaccinated. So children 5 to 11 are now eligible, and we need to continue to make sure we're doing everything to get them vaccinated. So as of now, masks will be staying in place. So I will not respond specifically to ongoing litigation, only to say that we will certainly comply with the courts and that our approach has been a public health approach where we first provide notice, we certainly provide storage, and we are working hard to identify beds, and we are not asking anyone to remove their property, their belongings, or to move off the streets without first identifying a place for them to go that is appropriate, meaning whether that is treatment, whether that is a low-threshold bed. We are working hard to match the individual needs of the people who are living on the streets, living in tents, with the appropriate treatment and shelter options available. We have just begun this work this week. It is ongoing outreach that happens every single day to connect individuals who need support to treatment and to services. We have made progress. There's more work to do, but we continue to use a public health approach, first making sure that we have options available and options that are appropriate to the individual needs of the people who are living in tents.
Mayor Janey, now that you got some perspective to look at, during your administration at City Hall, have you done anything differently when it comes to COVID-19 policies for people who live and work in the city?
You know, I'm really proud of the work that we've done here, and I want to thank Chief Martinez and Dr. Ojikutu again for their leadership, as well as all of our community partners who have been on the front lines helping all of us fight this pandemic together. We are one of the most vaccinated big cities in the country, and that is because of the work that we've done here at City Hall, but really the work that has been done out with our partners, including hospitals, community health centers, and the community groups that are working hard in neighborhoods that are hardest hit. And so I'm proud of that work. We will continue the mask mandate. We were the first to implement a mask mandate in our schools. We have done a lot of important work to slow the spread. It's why we remain below all of our metrics in terms of of metrics of concern in terms of COVID. And we just need to continue to do everything to get folks vaccinated. That is our best protection against this deadly virus.
How differently or changed that you've been able to turn back time?
I'd love to get even more people vaccinated, offer more resources to community groups who are working on the ground so that we, particularly in neighborhoods that are hardest hit, we still see some gaps by race and by zip code, and so it is important that we continue to focus on those areas. And that is what I would certainly suggest to the next administration. We are working closely. I speak daily with Mayor-elect Wu. Her team is working closely with the administration now in terms of transition so that we don't lose anything as we transition, and we continue to focus on getting people vaccinated and slowing the spread of this deadly virus.
What would be the main thing you want to get to the administration? Some of these meetings happening. What's the main goal?
There are meetings every afternoon. There's constant communication. We have been discussing all of the urgent issues, including the opioid crisis and homelessness crisis. We've been discussing COVID, all of the work that needs to continue around housing and supporting small business. All of that is ongoing work with this administration, the new administration coming in.
Just regards to police and schools here in City Boston, they were moved at one point in time from the hours schools that we talked about social workers. Given what happened, why were they
So this underscores the importance of investing in social, emotional supports in our schools, for more social workers, for more nurses, to make sure that we are using trauma-informed practices in our schools. That is the focus that we must lift up after this incident and continue to focus on. It isn't about police in schools. Police in schools do not make us safer. There's lots of research that backs that up. What we do need to do is make sure that we have trauma-informed practices and that we are doing more in terms of social, emotional learning. Thank you so much. I really appreciate you.